throat, you say, oh, I have a sore throat, it's viral. Nobody's gonna go for viral culture, that's fine, good for you. But if it is stepped, group-based streptococci, keep that in mind, the antibodies which you're going to make are going to cross-react with the antigens of the heart, because this is what happens. And it can occur by error-prone reverse transfer. This is like a method for that, how the variation happen, because this is like normal for, it happens more in viral as compared to bacterial. Mostly, that's why the antibiotics are more stable than antiviral. You normally don't get any preventive bacterial vaccine when you get flu shot. So that's the reason, because the variations are there, except you can see from where Streptococcus pneumoniae, trypanosomes, and group A streptococcus, that's where we have antigenic variations. Does that make sense? Any question on that? Clear? So I'm just giving like concept points that should stick in your mind. And I mean, I myself learned in an associated memory way, and again, you should also do the same, because you cannot take it lightly. It's going to come and haunt you over and over again, and many times in your clinical practice and rotation, they don't just quiz you as I quiz. What is a significant group-based streptococci? What is endotoxemia? Why do we appear? So you have to have some information in your mind, otherwise you're going to be totally like dumb at that time, which is not good. Okay? Right, let's move on. Another class of bacterial infection, which are intracellular. So, for bacteria to appear in the blood, for immune system to see it, respond. But if the bacteria are smarter, they're going to hide it in the cell. When they're hidden, then there's a problem. Because cells have to see them physically. If they're hidden, there's a problem, right? So, very small intracellular, smart part of the bacteria that they hide in components, and then they keep on dividing without immune system knowing it. And then the worst example is MTB. I usually used to say that, how many bacteria do you need to give you a TB infection? Sometimes for some bacteria it's 1 million, sometimes it's 10 million, sometimes it's 100. What do you think about TB? 1. And it may sit in your system. You may get infection 30 years ago, right? And it goes over here. And if you remember the virology lecture, at that time I gave a quotation by the Secretary of Health at that time, that if you are having an intercourse with a person, you basically having an intercourse with the person that person had for lifetime. So they picked up, so he or she may have picked up an HIV 10 years ago, 20 years ago, and that's in the system. So if you have a sexual relationship with that, you pretty much are going to carry that load and get infected, right? And then there is also a long incubation period. You ask a person, take a history of STD, he says, I'm okay, I'm good, this and that. So he probably thinking I didn't do any kind of weird thing in the last 10 year, 5 year, but maybe 20 years ago. The system disappeared and comes back again. That make sense? So that's an intracellular bacteria. But again, Listeria is also, fungi also sit in the system, and Toxoplasma gondii also. The other important thing is some of the bacteria are way smarter. They have learned how to disguise themselves and evade the immune system. They suppress the immune system, so that this is passed through the system without knowing. And Epstein-Barr virus, herpes simplex virus, they have those specific genes that can sit in your system. And it's just like you must have heard that people who didn't have varicella vaccine, at childhood, so they will develop shingles later on in their life, because the virus sits in the nerve for X amount of years and shows up later. It's just like autoimmune disease, where the autoimmune cell that escaped the T cell is sitting in your system and tends to come at a middle age. That's why, remember when I taught you autoimmune diseases, I told you it is gender specific, most of the time very high occurrence propensity in female middle aged. it must have happened in the womb, where these T cells or B cells, they escaped. The cells that could recognize your own self as non-self, and they come back and haunt you. So that's pretty much the situation where you have suppression of the immune system, you get more diseases. Well, can you give me any pharmacological example where if you suppress the immune system, you're going to be prone to infections? Any pharmacological?
Uses of steroids.
Very good. Good. Well done. Pat yourself on the back. If chronic use of steroids, if you're giving chronic use of steroids, you're going to be prone to infection. So keep that in mind, it's not good. It's a very common question asked in medicine, very common question asked. And whenever you give long-term steroids, whether for asthma or skin diseases, you better give a shot of antibiotics as well. Because steroids suppress the immune system, and we are talking today that the immune system is responsible for taking care of infection, so you're prone to infection. Good. All right, let's move on to the last slide of today. We talked about some enzymes, some bacterial infections which produce specific enzyme, because it's like a waging war between you and microbes. They're smarter than us, we're learning from them. They release exotoxin, endotoxin, but sometimes they release enzymes. The enzyme which degrade immune molecules. Right? It's just like, you want to cross the barriers and you want to fool the enemy. So they go and they have enzymes which are going to destroy cells, which are going to destroy antibodies, which are going to make a big mess of the immune system. And Neisseria meningitis, Neisseria gonorrhea, what they produce is an enzyme which is protease, it kills IgA. So IgA is required protection at mucosal sites. Whether the mucosal sites are oral, anal, vaginal, everywhere, so they are protective. So you get infected, STD with that, it releases an enzyme, it chews up IgA, so you are not able to resist infection and you get infected. IgA protease is the example for that. The other important thing is that the expression of antibody binding proteins, so they release specific antibodies that they actually proteins that bind to the antibodies. So you can see pathogen that express cell surface protein that can bind to FC region. So if you kind of making them, it's just like making them useless. Just like this is a fight between you and your bacteria, and you have to make IgG, and it kind of takes that trigger out or kind of shunts the system. And these basically proteins are called FC binding proteins and protein A and protein G. So very specific proteins that are released to block the system. It's just like, for example, this is a modern day war, and you want to have a missile sent to an army, and you have a program that's going to block the navigation system. So bacteria are smarter than that. This is exactly what they would do. Okay, so they release a protein, right? Because FC portion, remember what is the FC portion of the antibody? What are the two parts of antibody? Fragment for antigen binding, arms, Fab. FC is the legs where the antibody binds to the cell membrane. So that is required for them to hook onto bacteria, and you have a protein that blocks that. So this is what the issue is in terms of the immune system looking at the infections, and immune system fooled by infections. There's always a war going on between you and microbes. And it's not our win-win situation because we get sick, we have to be treated. But if your immune system is good, most of the time, let's say you had 100 attacks by bacteria, actually we have every time, everywhere you can culture, there is bacteria. Everywhere is bacterial viruses. That's why we take preventative measures, wash your hands, put the gloves, so and so forth. You don't even feel because immune system is good. But if you're having immunodeficiency, then you have to be kept in a very special place, and you have to be careful because some of the bacteria are going to be nasty, right? And then if you're at extreme ages, too young and too old, on steroids, having AIDS, having chronic diseases, so your immune system is already weakened, and the microbes is gonna come, infect you, and cause problems. Yes? So I hope that that kind of interactive discussion puts this information in your mind for at least NAPLEX exam.